Hello there. My name is Jack, and in this tutorial, I'm going to show you how to use Platomed's NeoEHR solution as a doctor. Let's get started. First, you will need to log into your account. Input your username and password in the designated areas and click on Login. On your home screen, the Outpatient/Inpatient toggle on the upper left side of the screen is set to Outpatient by default. The list of patients assigned to you by the nurses, currently awaiting consultation, is displayed on the screen. To see patients on the ward, set the toggle to Inpatient. On the drop-down list, you will see the wards to which we've been assigned or that we have permission to access. On selecting a ward, a list of patients on each ward and their summary information is shown. Let's return to our Outpatient screen. You can reassign a patient from yourself to another doctor using the Burger menu option, or use the View All Patients button to access the View All Patients screen. From here, you can assign a patient to yourself or to any other doctor in the clinic. Now let's see Blessing Zaria, our patient. If your hospital has set up Neo's patient display module for TV screens, tapping on the call button on Blessing's card will relay a message informing Blessing that the doctor is ready to see her and the consulting room. To enter clinical data, tap on the card bearing Blessing's name to access the All Inputs screen. Clicking on the Patient Encounter Timeline button brings up the Patient Encounter Timeline, where we see a running patient history including the vital signs most recently recorded by the nurses. Now let's enter Blessing's symptoms. Tap on the Search Symptoms bar to open the Presenting Complaints panel. Blessing tells us she has been experiencing abdominal pain, central and left-sided, for 2 weeks. The pain is sharp, burning and worse at night. She has been feverish and nauseous, but has not been vomiting. Blessing also informs us she has been convulsing for the past 3 days. She reports less than 1 episode in 5 minutes. She had not been diagnosed with epilepsy previously and is unconscious when she has the convulsions. You can also type the history by selecting the Type Notes toggle. Let's add in our diagnosis. Blessing might have epilepsy, so we will add that in as a differential. To request investigations, click on the Request and Record Investigation Results drop-down. Recent results shows you any previously recorded results. To request tests, click on Request Investigations. We can now select tests that we would like Blessing to undertake. We may want to request urgent electrolytes for Blessing, for example. We can add any additional notes to the laboratory staff in the Add Investigation Notes box. If Blessing had any paper results she had brought in, we can click on Record Results to enter that result. We can also click on the camera icon to attach an image of the paper record. Let's now add a prescription. Tap on the Prescribe Medication and Vaccination card to open the Prescribe Medication panel. Search for the desired medication using the search bar. We will commence Blessing on ceftriaxone 1 gram 12 hourly IV and IM paracetamol 650 mg 8 hourly for 3 days. Note that adding in a duration and directions are not compulsory. We can request procedures and other plan items by using the specified panels. Since we have requested a CSF culture, let's go ahead to ask for a lumbar puncture to collect the CSF. We can also request that oxygen saturation be monitored. We can add any additional notes in the Add Notes panel. We will add a note here specifying that Blessing had previously been treated for malaria and typhoid in 2 private hospitals before the seizures commenced. Finally, let's admit Blessing. Our wards and beds have been set up by admin in Settings, so we pick a ward and select an available bed for Blessing. To close, we will review our notes. We can see that the vital signs and physical examination findings recorded by the nurses have been included in our notes. We can edit any changes or go ahead to save, if we're okay with the automatically generated notes. At this point, our investigation requests have been automatically sent to the laboratory and the prescription has been sent to the pharmacy to be filled. We can perform a number of additional functions as a doctor. Refer or request a consult for a patient, request a next appointment, view paper records or discharge a patient. However, we will go through those separately. And that is it. We have successfully seen Blessing and recorded our notes, which are now visible to be read by nurses and doctors on the ward. Feel free to visit these links displayed to view even more resources that you can find helpful, or reach out to our support team using the link displayed on your screen.